My name's Paula Hagel, and I'm the exercise physiologist in Good Shepherd's Cardiopulmonary Rehab. And today we're going to be talking about stress management. And our goal is really today with this lecture is to introduce acute stress, chronic stress to you, and give you some practical techniques to help reduce the amount of stress in your life. So stress is something that we all have, and it may come from our family, our commitments, our work environment, and our own attitudes, perceptions, and fears. And not all stress is negative. Some stress is positive. The purchasing of a new home, a start in a new job, retirement, the birth of a child. So not all stress is negative, but generally the positive stress, it helps you be at your best and help you get motivated if you're working on a project or something. So not all stress is bad. The negative stress or distress or chronic stress or long-term stress, all those terms are kind of interchangeable. And distress is when stress becomes too much. And that's when we face continuous stress over time. Our energy to adapt runs out and we get exhausted. And distress is what may lead to more serious illness. Now, short-term stress is referred to as the body's response in a fight or flight. So, for example, you have increased heart rate, increased blood pressure, increased breathing rate, muscle tension, you're more mentally alert, and you have the release of stored fats and sugars into the blood. So literally you are ready to stand and fight or run away. And this response can happen whether it's an actual physical threat, like you're walking your dog and another dog jumps out of the bushes and really gives you that fright feeling, that fight or flight response, or it can be your perception. So if you hate traffic and you're sitting in a traffic jam, you may have some of these the same response, this fight or flight response. Now, chronic or long-term stress or distress, what happens is we remain in a heightened state of alertness over a long period of time. And our bodies don't return to that normal resting state, and that's when our bodies and our health is affected in a negative way. And with chronic or long-term stress, you still have all the physiological changes you do with the fight or flight, the short-term stress response. But in addition to that, you may notice an increase in your resting blood pressure and heart rate. You may notice that your immune system isn't working as good as it has been in the past. You may have increased muscle weakness or fatigue, and then it may also affect your cholesterol levels. Now, the first step in managing stress is to recognize if we're having any symptoms at all. And what's interesting is I may present differently or have different symptoms than someone else. So I may have, not be able to focus where someone else may have back pain and headaches. So it's interesting to just kind of take stock and see, gosh, what symptoms am I having, if any? In addition to the back pain and poor concentration, some people may have tight neck muscles, be restless, and even experience more of a serious clinical depression. So if you are experiencing more depression-like symptoms, make sure you contact your physician. In addition to the first slide of symptoms, sometimes people will increase the use of caffeine, alcohol, or tobacco. Maybe they're not sleeping well, so they're drinking more coffee or soda to combat the tiredness or something. Other symptoms exhibited by people could be, constipation or diarrhea, extreme fatigue, overeating, anxiety or panic issues, sleep problems. So there's many different symptoms. So it's important to understand if you are experiencing anything that you may be under chronic stress, and these are your symptoms of that. So the second step in managing your stress would be to become aware of things that trigger your stressors. So is there a certain event that's causing the stress? How's your body responding? What are your symptoms? So what's triggering your stress response and giving you symptoms? So that's step 2. Step 3 would be to recognize what you can and cannot change. Can you avoid or stay away from the stressor? Can you manage them over a period of time and delegate possibly so that you don't have to be in charge of a certain project for the whole thing? Maybe delegate and take some of the weight off your shoulders. Can you take a break or leave the area? So recognizing what you can change is important. Sometimes if it's a problem or a person we're dealing with, and we have no control over how they respond, but we can surely recognize how we ourselves respond. So sometimes it's hard to understand and let that go. You can't change what's going on, but to let that go, and you can really reduce the amount of stress you're feeling by letting things go if you can. All right, so step 4 is to reduce the intensity of your reactions to stress. And what I mean by that is, is the situation really a complete disaster, or can you have more of a moderate positive view? Oh, it's a problem, but we're going to deal with it, and it's much more manageable, if you have the view that it's more of a moderate or positive view instead of, oh my gosh, it's a complete disaster. So sometimes just your own perception of a situation can reduce your stress response. So once we know our symptoms, we know what triggers it, and then we can deal with it. So slow, deep breathing can help bring back your heart rate and blood pressure to a normal range. Relaxation techniques can ease those tense muscles. And then there are different medications out there that you can talk with your doctor about if you need, for anxiety or depression or things like that. And we are going to do a short practical practice of the deep breathing and a progressive relaxation in just a moment. All right, another key to managing your stress level is to work on keeping your body healthy, getting plenty of exercise. Striving for 3 to 4 times a week is a great idea. I encourage you to really shoot for about 150 minutes a week of aerobic exercise, like walking, biking, swimming, hiking. Eating well-balanced, nutritious meals, maintaining your weight as best you can, avoiding nicotine, alcohol, and too much caffeine. Take breaks when you can, and try to get enough sleep and be consistent with your sleep routine. So, going to bed at the same time, having a cool, dark sleeping environment without any screens or electronics that can interfere with your sleep schedule. And maintaining the support in your life can help reduce your stress. Those relationships and friendships that you have really can make a big impact on the amount of stress you're feeling. Sometimes you need to work at it, give those folks a call, and work at that relationship a little bit, but that's okay, and it's also important that you're setting realistic goals that are meaningful to you. Expect some setbacks and frustrations, and be kind to yourself. And no matter what lifestyle change you're working on or what's going on, sometimes if you allow yourself a little bit of flexibility, whether it's diet, nutrition, or your exercise program, if you allow yourself a little bit of flexibility, that will help reduce the amount of stress. And for the loved ones out there, making sure that your friends and family that are your support are also taking care of themselves. And that's important to understand. It's sometimes if someone becomes ill, it takes a team effort, and the loved ones around you are experiencing that stress in it, as well. So it's just important that everyone takes care of themselves. And relaxation techniques are, we talked about deep breathing. Yoga and Tai Chi are 2 types of exercises that really can elicit a relaxation response, or help promote relaxation. And using mental imagery is a good one, and that's just a technique where you allow yourself to daydream. So for example, if you have a favorite vacation spot, allow yourself to go there, get comfortable, do some deep breathing, allow yourself to go there in your mind. Where if it's a beach, where you can hear the seagulls and hear the waves crashing and smell that salt air. So what it allows you to do is to be present, your mind and body, be present and not be stressing or thinking about other things going on. So mental imagery is a great technique to use. And then also calling a friend, listening to calming music, meditation, prayer, so whatever works for you, I encourage you to practice it on a daily basis if you can. And meditation can be as simple as just being in a relaxed position, doing some deep breathing, and it can really reduce the amount of stress you're feeling. Now, to actually do the deep breathing, to practice it, what I encourage you to do is get in a comfortable position, and we're going to practice this diaphragmatic breathing or belly breathing. So you would get comfortable and slowly breathe in through your nose to count anywhere from 2 seconds up to 4 seconds. So a nice deep breath in through your nose. So inhale 1, 2, 3. And then as you exhale, you're going to exhale out your mouth 1, 2, 3, 4, 5, 6. So what you're doing is you're slowing down your respiratory rate. You're allowing the blood pressure to come down, the heart rate to come down, and you can really literally feel just that stress just melting from your body. So I encourage you to practice this deep breathing technique, even if it's just 3 to 5 minutes daily. It can make a huge difference in your stress level. Or 10 slow deep breaths really work well for people. So you want to find what works, and then if you enjoy the deep breathing meditation, increase the amount of time up to 10 to 15 minutes a day. Okay, so that's just how you do the deep breathing. And when you inhale, you really want your abdomen to rise, and as you exhale, the abdomen falls. So you're getting deep breathing happening. And a progressive relaxation technique is for the muscles. So what we would do is do our deep breathing and then contract and relax the different muscles. And I do have a short example to share with you. And this is just a script that you can use, or find something on YouTube that can actually walk you through it. And I looked into, there's so many on YouTube, but this is just a text. But to begin your progressive relaxation, sit comfortably in a chair or lie in a bed and begin your deep breathing. Okay, so slow deep breaths. Okay, and I would just pair that deep breathing and then do the muscle tightening and then relaxing with it. So slowly start curling your toes and tightening the feet. So feel that tension build. Okay, take a nice deep breath in. And then as you relax the feet, exhale. And then focus in on your breathing again. Take a few slow, deep breaths in and out. And we're going to move up from the toes to the calf. So tighten the calf muscle and push the foot down at the ankle. Okay, hold it there. Feel that tension building. Take a nice deep breath in. And then let that go. And come back to your breath. Take a few slow, deep breaths in. And out. Another breath. And if your mind wanders, that's okay. Just acknowledge the thought and come back to your breath. Okay, so we're going to repeat that same thing on the other leg. Okay, so tighten that other calf. Hold it there, nice deep breath in, and then relax. And continue to breathe deeply. And so now we're going to move up to the glutes or the buttocks. So go ahead and tighten up the glutes. Hold it there. Nice deep breath in. And relax. Come back to your breath. Okay, great job. We're going to move up to the abdominal muscles. Contract those abdominals. Hold it there. Nice deep breath in. And release. Come back to your breath. Next, we're going to make a fist with one hand. Feel that tension throughout the forearm and bicep, your upper arm. Hold it there. Nice deep breath in. And release that side. And just let that arm hang heavy by your side. And we're going to switch to the other side. Make a fist. Nice deep breath in. And relax. Okay, great job. Tighten all the face muscles. Hold it there. Nice deep breath in. And exhale. And go ahead and review all the areas and release any tension or tightness that you feel. Okay, take a few more deep breaths. Release more tension with each breath. And allow your whole body to feel heavy. Sink more and more into the chair. You'll just notice that you feel completely relaxed. And I encourage you to give this a daily practice if possible. If you have any questions, feel free to call Cardiopulmonary Rehab at 541-667-3687, or you can email me at phagel@gshealth.org. So I hope you found this relaxing and a good way to reduce your stress. Thank you so much for listening.